Hello, everyone. My name is Shannon McLam. I'd like to welcome you to my Nursing 213 capstone project. The topic I was assigned was for newborn care. So throughout this presentation, we're going to be going over a case study for baby Johnson who has just been born and experiencing some different medical issues. So let's go ahead and get started. All right, so baby Johnson is a newborn patient who was just taking her first breath after 36 weeks of gestation. Baby Johnson is a female of Caucasian descent with a middle-class Christian parents. Upon birth, the medical team notices that baby Johnson is presenting with an abnormal skin color. That's all we have at this point. So, question number one, with the limited amount of information that you have with 36 weeks of gestation and the patient just being born with an abnormal skin color, what is the nurse's primary intervention right now? What is the first thing that the nurse needs to do? The primary intervention for a registered nurse should be to obtain an APGAR score. The APGAR assesses the newborn's activity, pulse, grimace, appearance, and the respirations. This score is taken at the 1 minute and the 5 minute mark of life and serves as the baseline for all future assessments. So the APGAR score revealed the following: a minimum response to stimulation, blue pale skin color, milia across the nose, slow irregular breaths, two umbilical arteries and one vein, and upon auscultation of the lungs, the nurse noted rales and crackles. This gave the newborn an APGAR score of 5. The nurse then assessed the vitals and found a blood pressure of 70/50, heart rate of 110, respiratory rate of 26, an O2 saturation of 82, and the baby's temperature was 96.8 degrees Fahrenheit when taken orally. With this new information that you just gained, what intervention would immediately follow obtaining the APGAR score? Given these findings, the nurse should attempt to clear the airways of the newborn. This intervention is a priority as the findings of the physical assessment indicate a lack of oxygen throughout the body. This is either caused by inadequate ventilation or an issue with the circulatory system. Checking the respiratory system is a faster intervention and is a more common complication than a cardiac issue is with newborns. Of the assessments performed thus far, which findings were normal and which findings were abnormal? If they were abnormal, tell me why. The normal findings were as follows. Number one, milia across the nose. This is characterized by small white bumps across the face of the newborn that mimics very mild acne. It's a very common finding in newborns and it almost always clears up on its own within just a couple of weeks. The second normal finding was the two umbilical arteries and one vein. This is normal as it suggests that there's no physiological defect in the umbilical cord. So, in theory, there should have been an adequate amount of oxygenated blood going to the newborn throughout development. Lastly, the blood pressure of 70/50. Though this is considered a hypotensive finding in an adult patient, it's a common finding for a newborn of this age. So here are the abnormal findings, which there are quite a few. So we're going to start with the top and go over each. Number one will be the minimal response to stimulation. This plays a part in the APGAR scoring. A normal response would indicate the newborn moving their arms and legs actively immediately after birth. The next finding would be the blue pale colored skin. The normal skin color of a newborn of Caucasian descent, which is what baby Johnson is, should be pink. It's not uncommon for there to be slight bluing of the skin around the mouth, on the hands, and the feet. This is known as acrocyanosis. However, bluing of the entire body is a sign of lack of circulation of oxygenated blood. Next, we have slow, irregular breaths. The normal finding with this assessment would actually be vigorous crying from the infant immediately after birth. A lack of such finding can indicate either a blockage in the airway or a malfunction in the respiratory system itself. Then we have the rails and crackles that were heard in the lungs. This finding indicates that there is fluid in the lungs of the newborn. This fluid is normal while in the womb, but is typically expelled out of the lungs during birth. This could also be an indication as to why the newborn's breathing is so abnormal. Next, we have the APGAR score of 5. A score of 5 indicates moderate depression in the newborn. Typically, medical staff want the newborn to score at a 7 or higher. Then we have the heart rate of 110 beats per minute. This heart rate is bradycardic for a newborn. The heart rate of a typical infant at birth is around 150 beats per minute. This could also be a causative factor in the infant's condition. If the heart is not pumping fast enough and not pumping enough blood throughout the body, that could lead to the cyanosis. Next, we have a respiratory rate of 26. This value is much lower than desired. A typical finding would be around 50 breaths per minute, especially the immediate following of birth. The fluid accumulation in the lungs is likely a cause for the slowed respirations. Then we have the oxygen saturation of 84. This value is below the standard for newborns and adults all the same. It's not entirely uncommon for an infant to have a lower O2 saturation immediately after birth, but a reading of 95 would be average. This is directly caused by the lack of ventilation and the accumulation of the fluid in the lungs. Lastly, we have a temperature of 96.8 degrees Fahrenheit. That temperature was taken orally, and this temperature reading is just under the recommended temperature range. The lack of circulation of warm blood is likely to cause drying of the infant and placing her skin to skin with the mother or on a radiant heat source will likely correct this issue immediately. Question number 4. What is the next assessment that the nurse should perform at this point in the newborn's treatment? The nurse should auscultate the infant's heart sounds to determine if there is an abnormality, such as a murmur. An irregular heartbeat could indicate a cardiovascular problem causing the cyanosis in the infant. Another assessment will be to check for peripheral pulses to ensure that there is oxygenated blood reaching the extremities. Lack of peripheral pulses could indicate the early stages of shock. The nurse should then check the reflexes of the patient, as normal reflexes would indicate normal neurological function, which may decrease with a lack of oxygenated blood circulating to the brain. This is why obtaining that APGAR score immediately after birth is so important. Without that baseline data, you have no frame of reference to determine if the neurological function of this newborn is increasing, decreasing, or maintaining the same. Right, the next progression we have in the case would be with Baby Johnson's parents. So, as any parent of a newborn, especially a first time parent would be, they are very concerned about their child and they begin to ask questions about the treatment. So, as a professional nurse, you're going to be the one that they come to ask these questions. That leads us to question number 5. How should a nurse explain the situation to Baby Johnson's concerned parents? What would you say to them? As a nurse and a medical professional, you must never hide the truth from your patients. A professional nurse would inform the parents that a possible issue has been identified with their newborn. The medical team have seen these symptoms before and are already running all the necessary tests to positively identify the underlying issue. You, as a nurse, should provide reassurance to the worried parents that the medical staff is working hard and doing everything they can to treat their newborn. And lastly, keep the parents updated frequently. Just by providing frequent updates, you're showing the parents that you understand their concern and you share their concern about their newborn child. What orders do you anticipate the healthcare provider to prescribe at this point in the case? So I would suspect that the healthcare provider would order a round of labs to assess for a metabolic condition. I also anticipate a set of arterial blood gases or ABGs will be drawn to check the oxygenation and the compensation in the newborn. It's obvious that there is a problem with either the circulation or the respiratory system. Now, baby would be cyanotic because of a lack of oxygenated blood reaching every part of that newborn's body. So by taking these labs and these ABGs, we'll be able to further pinpoint where the problem actually lies. So the labs came back, and here are the results. We have a hemoglobin and hematocrit of 168 and 54 respectively. Platelets are 180. Your C-reactive protein is a 5, blood type A, positive for Rh factor, and a bilirubin of 4.7. The sodium is 146, potassium is 6.2, chloride at 103, and calcium at 2.0. And then for the ABGs, we have a pH of 7.27. We have a PCO2 of 59. And HCO3, that's going to be your bicarbonate, is at 19. And then your PO2 is going to be at 44. So a note real quick for the bilirubin. Bilirubin is higher on this lab, on this particular lab reading than it would be, let's say, in a week's time. So due to the stress of birth, you will see the bilirubin levels elevate. However, as long as they don't reach 5 or higher, there's typically no particular need for an intervention by the medical team. So with the 4.7, it would definitely be something to monitor. But at this point in the newborn's life and this stage with all the other things going on, bilirubin would just be that. Just monitor it. There's no need for an intervention right now. So with those lab values, I've already told you what the bilirubin meant, but could you interpret the rest of the lab values? What I'm looking for are which values are abnormal, and if they are abnormal, why? Here are the three lab values that were abnormal. A lot of what's going on with baby Johnson all fall within the normal category, but these three are very important and they're further leading to what our suspected cause is. So the first one, the pH of 7.27. This value indicates that the newborn is in an acidotic state. This is likely due to the buildup of carbon dioxide secondary to the inadequate ventilation. The PCO2 of 59. This value is high, which is as to be expected for this patient whose ventilation is inadequate. The high PCO2 will cause an acidotic imbalance in the blood, leading to the low pH value that we just saw. And thirdly, the PO2 of 44. This value is low, which is also expected given the other two results that we just went over. A high a high PCO2 and a low PO2 indicate inadequate ventilation, which will in turn lead to cyanosis and possible hypoxemia and a decreased pH value. Given these lab results, what follow-up treatment do you expect the provider to order for baby Johnson? At this point in the case, I would suspect that supplemental oxygen will be supplied to the newborn per healthcare provider orders. And then a possible intubation of the patient if respirations and oxygenation do not improve or if they in fact worsen. Admission to the neonatal intensive care unit for monitoring and treatment is also a very high possibility, being that the newborn was born prematurely and is experiencing respiratory distress. Baby Johnson is moved to the neonatal intensive care unit for further treatment. It was ultimately decided that the fluid accumulation in the newborn's lungs caused a decrease in gas exchange. This decrease in gas exchange led to the desaturation of the newborn, and the newborn was placed on a ventilator temporarily until the fluid in the lungs could be excreted naturally. How would you prioritize the care for this patient in the NICU setting? There are two main priorities that I would focus on as the NICU nurse. The first one would be to monitor the oxygen saturation in the newborn. With the child being on a ventilator, we're going to need to verify that the settings are set appropriately. We could use respiratory therapists to aid us in setting these settings on that ventilator to make sure that we are helping the newborn breathe, but also allowing the lungs to develop properly. We are also going to need to monitor the fluid accumulation in the lungs, with the primary problem being that lack of gas exchange due to the fluid accumulation in the lungs. Not only could the newborn desaturate quickly, but the newborn also stands a chance of developing pneumonia. Secondly, the nurse should monitor the infant's skin color and temperature. Comparing these current assessments to those found during the APGAR scoring at birth will allow the nurse to determine if progress towards a healthier status is being made, if no changes are being made at all, or if the newborn's condition is worsening. After 2 weeks in the NICU, the baby's lungs are clear of fluid and are developed enough to begin breathing on her own. She remains in the NICU for close observation in the event that a critical intervention needs to take place, but shortly thereafter, baby Johnson is healthy enough to be discharged home. However, her parents are nervous about caring for their new baby. They express concern about identifying medical issues in their baby as well as how to intervene if necessary. As a registered nurse providing the discharge instruction to the parents, what education would you provide them about the care of their new baby girl? Providing the parents of this newborn with written instructions, including pictures, is a great start. To ensure that more than one learning style is covered, it'll be beneficial for the nurse to review the material with the parents, answering any questions that they have along the way. The educational material should include basic guidelines and tips on how to care for a newborn baby. Being that baby Johnson had medical issues at birth and was on a ventilator, she does stand a higher risk for developing respiratory issues early on in her life. So, material about how to identify certain respiratory distresses in newborns should also be included in the packet and should be gone over by the nurse. It's important to make sure that you are both vocalizing this education, demonstrating this education, and providing take home materials, as the risks for baby Johnson to developing another respiratory disorder are very high for the first few weeks of life. Okay, that is the end of the case study. There were 10 case study questions as you went through and saw. So now we're going to all participate in a Kahoot challenge. So there are going to be 5 questions on this Kahoot. If you will follow the link below, and we'll go ahead and get started.